So I'm Elizabeth Johnson. I'm the co-CEO of the Healthcare Advocate Summit. So you might see me a few more times over the next few days. Maybe not, I don't know. But I am thrilled to be able to bring a little bit of a different panel. So usually we talk about medication access, reimbursement, affordability, all very key important things. And we talk about it a lot from health system versus private practice, pharmacy versus pharmacy tech. We've got a lot of nurses in this field, especially moving into the advocacy side of things. And so I, as a nurse, and my partner, Melissa, as a pharmacy tech, I'm thrilled to be joined by 4 other nurses. So this is Healthcare Advocate Summit's first nursing panel. I'm very excited about this. So I volunteered to moderate because, I wanted to join my crew over here, but more so, I wanted to be a part of this because I think more nurses can truly get into the advocacy world. We have a lot of passionate causes beyond just being healthcare heroes. So this is our opportunity to do that. These 4 women have incredible organizations they work for, with, have started, are friends with. So I look forward to them sharing about those and how they their stories became that way. I have personal questions, so as a moderator, I'm going to ask them questions, but we'll leave plenty of time at the end for you guys to ask questions as well. So if you guys want to go down the line and intro yourselves, let's go.
Hi, everyone. I'm Sarah Warren. I've been a registered nurse for 5 years now. Last year, I had to take a sabbatical after an injury and kind of went into the patient side of things. But during that time, I was gifted time, right? I was able to start a nonprofit for healthcare worker mental health after a nurse left his shift and didn't come back in the Bay Area. And it's called Don't Clock Out. We've been creating this national peer support network over the last year, and we've been able to kind of bring back joy through community. And I felt fulfilled in a way that I hadn't in my career at the bedside, especially over the last 3 years of my career. It was incredibly difficult. I faced moral distress, burnout. I questioned whether or not I was meant to be a nurse to begin with. I got to the point where I was not only numb at work, but numb emotionally towards my family members, my friends, and my patients. And I took that as a sign that I wasn't meant to be in that space. To be able to kind of transform healthcare, I needed to be out of it to be able to support people through what they go through and also support patients in the process. So it's been an amazing year and a half, starting something new, but it has been incredibly fulfilling. And through this, I get to meet incredible people. I work closely with each person on this panel, and it's also how I got to meet you. So it's been wonderful.
Awesome. I love Sarah. Honestly, I could listen to her talk all day. So my name is Christy Snodgrass. I have been a nurse for the past 10 years. I started out in med-surg oncology, where oncology was my specialty. I was a chemotherapy nurse as well. I saw that my chemotherapy patients were going into crippling debt to get their chemotherapy treatments, to get their radiation. And I couldn't figure out why. As a nurse, I wasn't being paid that well. My doctor friends, they didn't understand exactly where all these charges were coming from, exactly how reimbursement worked. So I said, well, if the ones who are delivering healthcare don't understand the cost implications, how can we better serve our patients? We don't know exactly what care holistically to give our patients. So I ended up going into case management to learn about the reimbursement side of healthcare. And the more that I learned, the more that I wanted to share with my fellow nurses, my fellow healthcare workers, and with patients so that we could all understand. Unfortunately, working within healthcare, I could only be so bold and so loud as far as what I could share. So I decided, F it, I'm going to leave. I'm going to leave healthcare. I'm going to leave bedside. And I founded my organization, Healthcare Reformed. We partner with other organizations nationally. We help build national advocacy programs as well as influence policy change. So that's what I'm doing now. I love it. And I'm going to kick it over to Abby.
Thanks so much. My name is Abby Donley. I'm a registered nurse. I've been a nurse for about 15 years. I was bedside for 13. I was working in the COVID ICU in Manhattan during 2020 and 2021. And even before that, there's obviously a lot of problems with healthcare. We all know that. I saw a lot of, prior authorizations issues, a lot of medical debt with my patients. I also saw a lot of exploitation of my fellow coworkers, and not just nurses, other healthcare workers as well. And during that time, during COVID, it really gave me that time to think, why is this like this? Why do we have to work under the system that is not serving patients and it's not serving healthcare workers? So that's when I founded Impact in Healthcare, which is a nonprofit organization. We are a group of healthcare workers and patients that are trying to make system reform through education, research, and direct action. We have an amazing group of people. And also, just like I want to mention, I get to work with fabulous people like everybody here on this stage. So I stepped away from the bedside at that time, and I couldn't be more grateful to be here with all of you.
Hey everybody, my name is Portia Waffer. I've been a nurse since 2010. Most of my experience is in long-term care and home health. As a home health care nurse, what I noticed was that a lot of times my patients couldn't understand the material that we were giving them, the pamphlets and the brochures. So I rewrote it. So that my patients can understand. And I was wondering if I could do this for other companies. Could I blog? I love to write. And I found out that, hey, people will pay nurses to blog. People will pay nurses to write. Well, while I was writing, I noticed that a lot of nurses were coming forward as influencers, and they were using their platforms, such as these three ladies do. And I was also able to help a lot of my clients with the disparities in their content. I noticed sometimes their content was biased. Sometimes it perpetuated racism. And I would say, hey, I don't think you should write that like that. I don't think you should say that like that. They will hold conferences about, racism in healthcare, but there was no one of color on the conference. And I'm like, how can you have a conference, a panel on racism in healthcare, but you don't have anyone of color? And one of my clients is a really big health education platform, and they wanted to know if I knew any nurses who were into creating content for platforms. I happen to know a lot of nurses who are influencers, but I also noticed in the influencer space, there was a lot of discrimination as well. A lot of influencers were not people of color. A lot of influencers were not from the LGBTQIA community. And so I founded a healthcare influencer network. And what we do is we pair healthcare professionals with brands to promote health equity and increase access to care.
So amazing, right? So I also started a nonprofit, so I'm with you guys in that same boat. I don't know if nurses are gluttons for punishment or what that is, but one thing that these ladies are being very shy about and not talking about is their incredible social media following. So if you are following someone on Instagram, I highly recommend keep messaging them until they answer, Christy, because that's what I did. So I actually am a huge fan of all of these ladies, and I personally, I would say stalk them on social media. I do. And so like with Sarah, I was like, hey, we're at the same conference. Any chance we can meet up? I'd love to talk to you. And then send another message. And here we are today. So I have incredible respect for you guys being so vulnerable and putting yourselves, your histories, your organizations out there. That takes a lot in today's day and age. I mean, we see what happens on the news and political figures and, coming from, a career that if you think about it right now, what happened at Vanderbilt, right? With that nurse, being a nurse is both scary and rewarding, like pizza party rewarding, apparently. So we kind of face this, this stigma, we are heroes, but we ask for too much. We are the backbone of the hospital, but we're not wanted in private practice. And it's such an odd place because I know without a doubt, every woman on this panel has a heart of gold and they went into nursing because they're passionate individuals. So thinking about your passions, right? You guys have kind of mentioned about your organizations. What was your trigger moment? What really got you to start? And if you want to go down the line, mix it up to you guys.
I call this my origin story. The anti-hero, right? So I was like that stereotypical bright-eyed and bushy-tailed nurse. My mom my mom is a nurse, NICU nurse, 17 years. And I actually graduated from the nursing school that she went to, which when she went to it, it was a community college. And I did the associate's degree program once it became a state college. And I knew I wanted to be a nurse. I was so excited about it, so passionate about it. When I graduated, I went to therapy because I was like, I need to be well before I care for my patients. And that was life-changing. Everyone should go to therapy before they go into healthcare, number one. Or while you're in healthcare. Yes. I was like, yeah, literally. I'm like, I need skills to cope with all of this. And so that's like kind of origin story-esque. It's like foreshadowing almost to where I am today. So 2018, I graduate nursing school. I burn out within my first year. Why? Bullying, harassment, feeling overextended. I worked on a progressive care unit and we had 32 beds, right? Then my hospital decided we're now an observation progressive care unit. Billing is a little different. This is going to be the moneymaker for the hospital. So we're going to expand to 72 beds, but we don't have the staff to actually do that. So you're, instead of taking 3 to 4 patients, you're now going to extend to 5. And this is in Florida. I felt so frustrated because I wasn't giving my patients everything that I wanted to give them. I felt overextended, exhausted, frustrated. I was like, is this really what nursing is? And then 2020 happened. I actually escaped my unit in 2019 to volunteer to work on a COVID unit because I thought that would be better than the leadership that was abusing me, the bullying that I was facing, and how exhausting it was on that floor. I literally decided COVID might be better than this floor. Obviously, that was a really bad decision for my mental health and my physical well-being, but lessons learned. Went through all of that, went through the pandemic, went through the absolute worst, darkest part of my mental health in summer of 2021 during the Delta variant and COVID. But before that, I met with administrators at my hospital. I met with the CNO and the COO of my system that covered 5 hospitals across this area that I grew up in. I spent 20 plus years living in this area and also my mom working in that same system. And I spoke to this COO and CNO face to face after I wrote them a letter about how the nurses were crying in the break room, nurses with 30 years of experience crying in the break room because they saw their assignment, they didn't think they could handle it, and they were worried for their license. And I said that to them. I also told them, you can't have patients on BiPAP 100%, on Airvo 100% without central monitoring. Why are there no central monitoring on this unit? You're giving us ICU level patients and we're not monitoring them appropriately. So that got changed. That immediately got changed because I wrote on paper that you are putting patients at risk. You will kill these patients, right? But when it came to the mental health of these nurses, when it came to retaining these nurses, I was asked, you know, Sarah, it would cost $2 million to give everyone in this system a $1 raise. Would you be happy with $1? What I got from that was, I'm not worth $1 more to this institution, to this company, to this system that my mom has spent 17 years of her life dedicating her time to. When she got to 20 years at that system, she got a brochure that said, here's a gift for you. Nothing in that brochure was worth more than $30. That was my origin story. That was the moment I realized, like, I'm not going to make the change that I want to make while working for this system that is harming me, my mom, the patients that I care for, and my colleagues. Flash forward to 2021, I ended up having an injury, had to have back surgery, had to step away from the bedside. A nurse in the Bay Area left their shift and actually ended their life. And I found out about it through social media. A couple weeks later, I reached out to his best friend and roommate. Actually, his best friend and roommate reached out to me after I wrote a piece in Business Insider about healthcare worker suicide. We started Don't Clock Out that night at 3 a.m. my time, midnight Bay Area time. And it has been growing ever since. It's a national movement for healthcare worker mental health. that addresses not only our mental health, but the exploitation that has led us to this point. And it's why I'm here today. And I don't know how to tell that story in a concise manner, so I appreciate you for listening.
Love it. I love it. I told you I could listen to Sarah talk all day. I seriously could. Okay, so my villain origin story. Like I said, I went into oncology. Cancer runs in my family. I was gung-ho about doing oncology. When I applied, there was almost 100 other applicants. They did phone interviews. They did panel interviews in front of the entire manager system of the hospital. So every manager of every floor sat at this long conference table and just grilled these graduate nurses. And after that, they sent me to an ethics interview. So I had passed these three. I wanted to do oncology. They started me on the floor. Day one, I was on a floor that was not oncology. And I was like, this is not where I got hired onto. What's happening? And they were like, oh, this is a new graduate nurse program. Come to find out from the other nurses that none of the other floors on the hospital, including the one that I was hired onto, had enough experienced nurses to train a new nurse. So they concentrated us all on this one floor that had the most experienced nurses. I did 3 months of that and was thrown onto the oncology floor with zero oncology training. Day one, a doctor asked me to go do a procedure that I have never done. I turn and I look at my charge and she says, just go. And I'm like, okay. So that was the start of my nursing career. 6 to 8 months in, I was charge nurse because there was no one else. 8 months in, I was already training new nurses because I was one of the most senior nurses at 8 months in on my unit. Eventually, I ended up getting chemotherapy certified. I was the only chemotherapy certified nurse for a very long time. There was 3 of us rotating through the hospital. The moment for me was when I was the charge nurse at a year in with a bunch of new nurses. I had a full load of patients myself. Half of them were med-surg, and I was doing all the chemotherapy in the hospital by myself. I was running back and forth. I had a near miss, a near accident that happened, and I just stopped and I thought, like, I could have hurt someone and I could have lost my license for things that were totally preventable. So I went to my manager and I told her, hey, A, we need more staff. This is not safe. We need more chemotherapy certified nurses. And B, I can barely pay my mortgage. I need a better salary than what I'm getting. And her response to me was, well, we'll just train somebody else to do chemotherapy. Wow. So this hospital, who put billboards all over my city that they were the only hospital that administered chemotherapy, and that was because of me, was willing to get rid of me in a second. Shortly after that, I was giving chemotherapy to one of my patients who was very recently diagnosed with cancer, automatically got hit with crippling debt. And one of the things that he said to me, he was very newly retired. He said, if I would have known that I would have lost all the savings, everything that I had by just one hospital admission, I would have just stayed home and died. So I'm sitting here and thinking, like, this healthcare system is not taking care of me. I'm burning myself out, trying my hardest to take care of the patients, but no matter what I do, they can still be ruined by one hospital admission. So something's got to change. And that's when I switched to case management. I learned about the reimbursement systems of the hospital. And I said, you know what, people need to know about this. And not only do people need to be educated about the revenue cycles and the reimbursement systems of the hospital, but we need to start doing things a lot differently. And we need to be very loud and very bold about it. So that's when I formed my organization, Healthcare Reformed. I started reaching out to other organizations around the United States and saying, like, hey, how can I help you? A lot of healthcare advocacy organizations, surprisingly, don't have a lot of nurses. That was one thing that prevented me almost from wanting to do this in the first place. Like, it gave me pause because I was like, man, where are the people who look like me? Like, I see a lot of business degrees. I see a lot of, there are doctors, but where are the nurses, like the hands and feet, the people who are like delivering the healthcare? Where are they in this? So when I formed my organization, I started reaching out to these other nonprofits. They were psyched. They were psyched to have a nurse. They're like, yes, we need somebody with your experience. Like, we need somebody clinical in this area. And all I had to do really was ask. So I've been partnering with organizations for the past 2 years. We do everything from like boots on the ground advocacy to advocating for policy change, to healthcare worker advocacy. And honestly, it's been amazing. I've felt, more enlightened than I ever have. Like, I feel more now. I feel like I'm being more of a nurse now than I was ever allowed to be at bedside. And that's almost what's really sad to me, is that I'm not one of those people who wanted to be a nurse to segue into something else. Like, I didn't want to be in healthcare advocacy. I wanted to be a nurse, but unfortunately, we have a system that is not designed for nurses. So I'm doing what I'm doing now so that eventually, whatever generations of nurses come behind us, will have a system that's designed for them.
Ooh. Yeah. Okay. My villain origin, there's 2 villains in my story. I mean, it's the system, right? And then me. I got started in healthcare as a nurse. My grandma was a caregiver for a long time. It felt really natural for me to get into that, follow her footsteps. And as I was the nurse that would stay after and do after hours calls off the clock to get prior authorizations for my patients because there wasn't a designated person, and those PAs would just fall through the cracks and the person would just never get their medication. I was the person who would volunteer to be trained for stuff without the proper training, frankly, because I just wanted to help the unit and I wanted to learn because I loved nursing so much. And I think I did start to see that the system was not taking care of me, and it definitely was not taking care of the patients. But nothing was so clear to me as during COVID. I mean, there's so many examples I could give. It's difficult to pick one. But for example, we had a charge nurse on our unit she worked there for 35 years. She had, her retirement was she was able to retire, but we were in a union. So if she worked 6 more months, her pension would get a little bit of a bump. So she decided to stay on for 6 extra months. And that's when COVID hit. She was begged by her husband, please don't do that. He was already retired. Let's just go. We can travel, the whole thing. She said, no, let me do this. It's for the family, etc. COVID hit. She got COVID because she was on a med-surg unit that was not being given masks. They were not prioritizing med-surg nurses at that time. They were shaming us. Don't wear your mask in the hallway. You're going to scare the patients. She got COVID. And I think we focus on the fatalities, which obviously we should and we need to honor. We also need to start talking about people who got hit with COVID and are disabled for the rest of their life.
Yeah.
And she's one of those people. And she gave it to her husband. Her husband passed away. She is now in a rehab, tricked and pegged for the rest of her retirement. And I saw that, and not only did I not see the hospital have any sort of outrage, change, let's get these folks masks, policies, initiatives, I didn't even see a flyer for her near the elevator. Like, hey, do you want to raise a little money, or do you want to do some kind of something for her family? It was just like she never existed there for all of those years. And that's when it just hit me like a ton of bricks. This system does not care about me. It certainly does not care about me. It does not care about the patients. And something has to be done. And that's why that was the moment for me where I started Impact because we have to take it back. The bedside healthcare workers, we have to take the system back. It has been overtaken by folks up in a C-suite somewhere. And I'm sorry, but we need people who are actually caring for patients to be the ones in charge of how this is run.
I got my nursing journey started. I was in the ICU for 2 weeks. I never wanted to be a nurse. Nursing was not on my radar. I wanted to be a forensic scientist. I love CSI. And I was in the hospital for 2 weeks, and the nurses were just so compassionate. And I just could not wrap my mind around these people who I've never known. This is their first time seeing me. Why do they care so much? Like, why are they so compassionate? And I knew that, like, once I got better, was able to go back to school, that's what I wanted to do. I wanted to be able to help a girl like me who was in that position, who just needed someone to say, I care, who, when I couldn't eat, said, what kind of candy do you like? And sneak me in a Snickers bar. So that's why I decided to be a nurse. And when I got into home health care, I loved home health care. I love being able to take care of my patients, to teach them one-on-one, to able to see the difference that I was making because I worked in the area that I grew up and lived in. So we would discharge patients and I would be at Walmart and they'd say, hey, nurse, I remember what you told me about that salt, or, I'm checking my sugar the way I'm supposed to be checking my sugar, or I grew up with your grandmother and I can't wait to see her at church Sunday and let her know that you're my nurse and you're taking care of me. And I went back into long-term care and I was into staff development. I love to teach. I love to educate. I love to write things. Even as a home health nurse, I had the lowest readmission rate in our agency. So I got into quality assurance and I was able to help other nurses read their documentation and say, this is what you missed. This patient has CHF. Let's get them a scale. Let's teach them how to weigh themselves. And so when I got back into long-term care, I was in staff development and I was an infection control nurse, but that was right before COVID hit. We didn't see COVID coming. Got certified as an infection control nurse. COVID came, and now I'm responsible for making sure that our 105 residents and our 100 employees don't get COVID, in which we kept COVID out of our building for almost a year. And I was very proud of that. I was very proud of my team, but I also noticed that our sister facilities, they were getting hit, like it was killing them. They didn't have infection control nurses because they were so stressed out, they would quit. And so CMS says you're supposed to have an infection control nurse in long-term care. So what did the corporate do? The owner, the CEO of the company called me and said, Portia, I need you to train all the infection control nurses in the entire company. Well, in the state of Georgia, that was 10 nursing homes. And I was responsible for training all of those infection control nurses. And I said, we need more help. I can't be staff development and infection control. CMS says I have to dedicate 20 hours per week to infection control. I only have 40-hour work. Well, I'm supposed to have a 40-hour work week. How can I be a staff development nurse and do all the new orientation, make sure all the licenses are up to date, make sure we have all the education that we need. And also I'm having to be the only infection control nurse because I'm the only one that's certified, going around making sure our patients are taken care of. When COVID finally hit our building, it wiped us out. We had 80 residents with COVID. It seemed like overnight. And I was stressed out. I was burnt out. Our nurses were crying. Our CNAs were crying. Nurses were leaving to go traveling. We had a conference call and the corporate nurse basically said, if a nurse decides they want to leave to go traveling, we'll never hire them back again. And I'm thinking, these people are leaving because you guys won't give us a raise. They have families they have to take care of. If they're going to get sick, they feel like they want to make the money. And so what I realized was that we had no COVID or infection control policies and procedures. I had to create them and write them. But then I had the Department of Health calling me on the phone, telling me what I'm doing wrong, but you're sitting at home behind a computer and you're not here. And I'm in a hazmat suit from head to toe, going and taking care of head to toe assessments on 80 residents, calling their family members, telling them, hey, we think you might need to come to the window and see your mom because we don't think she's going to make it through the night. You know your mom is dying, but you have to come to the window and talk to her. We know she's dying. There's nothing we could do. And I was already writing and I'd already made my mind up that I would leave before COVID hit. But when COVID hit, I just couldn't leave. I just couldn't leave my colleagues and say, I have this job that I love, this side hobby that I love I'm making way more money than I am as a nurse, but I just can't leave these people behind. I'm the only one that they have in the building. And so I stayed for next year. Luckily, I never caught COVID. And when I left, I realized that there were so many people that were on social media that were doing conspiracy theories. COVID is not real, and you shouldn't take the jab. And I was like, people are listening to this. People would call me and say, I heard COVID is not real, like people that I knew. And I was like, why are nurses on social media saying COVID is real? You know, these are the signs and symptoms. Why aren't we educating people not only about COVID, but about a lot of other things? And that's when I decided, hey, if we're going to be social media influencers, if we're going to put out content, if these companies are going to pay people to put out content, or pay a nurse, pay a physician, because we have a license behind our name, and we're going to make sure that the content that we put out is credible. And if people are going to go to TikTok and Instagram and Facebook to get their healthcare content, let it be from someone like us who actually cares, and we're credible and we're relevant, and we're not going to just put out misinformation that can kill people.
And fun. You guys are so much fun. Great. Yeah, you're very fun. So obviously, there's challenges and there's things that you have faced in your careers. And, starting an organization, my entire career has been taking my clinical knowledge and blending it with ops and finance, right? I work in medication access. I can help physicians make money and I can help patients pay zero. It's a cool spot to be in. But there were a lot of things that I personally struggled with to get there. Companies to pay for my education, right? I have 5 certifications, now 6. I paid for all of those on my own dime. So in starting an organization, it's not just going to get a certificate. You guys are starting an entire business and you're learning how to do taxes and, what can you write off and what do you need to do? And just, for a lot of people out here who are starting healthcare businesses, especially in the advocacy world, tell me one of your challenges, just one little thing besides, the obvious system problems we have, but just some little tidbit that's wild, different that, you'd love to share.
Okay, fundraise for legal support immediately, because otherwise you will be screwed. Like, to start a 501c3 organization, if you have like $3,000 and someone who can write something really fancy for you and a lawyer and money for that, you could probably start one in like 2 weeks if you wanted to. But if you don't have that support, it's really difficult to navigate. And so you want to fundraise enough for reliable legal support to get you through that paperwork that they don't teach us about in nursing school, to establish your organization, to be able to begin more robust fundraising efforts, and to be able to start creating programs and do things in a way that is legal and protective, especially if you're trying to disrupt industries. It does put a little bit of a target on your back when you're trying to do things a little bit differently and you actually care about people. So again, get as much support as you can for legal, because that is something that is very important.
Very fair point. Christy?
Actually, I was going to go legal too, but mine was on the other side because all of us are on social media. And I'm just going to say, if you are saying hospitals' names on social media, you should also have a social media lawyer on retainer, making sure that you are not getting sued. But other than that, the best tip that I have given other nurses who are trying to get into this space is I'm just going to say I hate LinkedIn, but LinkedIn is a gold mine when you are trying to connect with these other organizations in this space. So one of my friends convinced me to get on LinkedIn, and I was like, fine, I'll do it. And then I
follow you on LinkedIn.
Yeah. And then I made a LinkedIn and I started just reaching out. I started just like Googling like patient advocacy organizations and then finding them on LinkedIn and then reaching out and just asking for a meeting and saying like, hey, can you just teach me about what you do? And surprisingly, a lot of them were like, yeah, let's hop on a Zoom. Let's talk about it. And making those connections and figuring out what was already being done in the space helped me not repeat other people's work, right? I could build off of what was already there, and it's been super helpful.
Yeah, I agree with both of those. Absolutely protect yourself. Be really mindful about not duplicating efforts. If there's already somebody out there doing really great work, get involved. I would also say if it's something that you haven't started yet, sit and really think. about what that means to start an organization. And don't think about just the end of it. Think about what it means getting up every single day. It can be a grind to go into it knowing that up front and deciding to commit to it instead of burning yourself out because you're working 24/7 and you're like, no one appreciates any of the work I'm doing. Well, they're not going to. They're just not going to. And that's okay. You know, you have to find your own reasons to do it. And that's what you should strive for.
Yeah, I love that. I think I would say do it anyway. So I'm an LPN, and people would say, you can't
Me
do it.
too.
You can't
See?
do it because
I was an
you're
LPN.
only an LPN. You can't do it. And I've been all over the country speaking to nursing associations, medical associations, working with really big companies, doing something as simple as content saying, you cannot say that. You cannot put that out there to patients. So do it anyway. If your license is stopping you from doing it, collaborate with someone else who has what you need to do it. Like, you know, as nurses, we're very flexible. We're very innovative. We'll find a way to make something happen. So just do it anyway. Collaborate. I've worked with all three of these ladies on stage. If I need something, I can reach out to them. Just collaborate. Do it scared. Just do it scared, and don't let anyone tell you that you can't do it because of this, or you should wait until you get this, or how about you do this. It's your vision, and you know that it's something that you want to do. It's going to make a difference. Do it scared. Use LinkedIn, reach out to people, use social media, send people a DM and say, hey, this is what I'm doing, and I see that you're doing this. I would love to collaborate and partner with you. And I have not had anyone to tell me no, because they see that I'm authentic. They see the work that I've been doing, and I've been able to get things done that I might otherwise may not have been able to get done. So just do it anyway. Take that first step, and don't let anyone tell you what you can't do, because there is a way for you to do it.
Yes, exactly. And so again, those direct messages, thanks guys for answering my Instagram messages over the years so I get to know you. But since this is our conference, and I know that you don't always get to, not this is a sales pitch, but what is an ask of your organization? What does your individual organizations need? We all know time, dollars, and all of that. But if that's the thing, I want to hear what that is. I want it to go on camera, and I want to be able to go back to this and see where we can go. So please, Portia, if you want to start, what's your biggest ask?
I think my biggest ask would be for anyone who is a decision maker in any healthcare organization, not necessarily healthcare, but if your organization has a healthcare niche, or your organization has a healthcare department. To a lot of these organizations don't understand social media and the impact that social media has on healthcare. Get on the phone with me. Luckily, Sarah and I work together every day. So get on the phone with me and let me tell you what social media can do for your organization and how it can impact health equity and increase access to care.
Impact in Healthcare has about 20 very dedicated volunteers that put in so much time. They're so brilliant. They're so creative. They're so kind. They're so generous. I need to find a way for the folks who want to come on board to be paid. I mean, I am advocating for folks to make a fair wage, for folks to have, access to mental health care, health insurance, pensions, if they want to unionize. These are things that I'm advocating in other spaces. I need to do it for my own people as well. And so to do that, we need funding. And I'm not an expert in that. I'm a nurse. I'm not an expert in fundraising in the nonprofit sector. So if anyone has any help, I would be happy to accept.
Good ask.
For us, I think it's exposure, and that sounds kind of cringy. In fact, when people refer to me as like a social media influencer, like a piece of me dies inside. But it is what it is. And what we have found is that nothing moves the needle more within these government agencies or these hospitals or these large companies than some bad press or good press, depending on what they're doing, right? So what we found is like we can knock down all the doors that we can possibly find. But when I post a video to social media and 1 million people see it, they're on the phone wanting to take a meeting with me because so many people saw it, right? So when I'm being the cringy social media influencer and being like, oh, can you please share this video? I'm not I'm not trying to get exposure to us. I'm trying to get to the people who can make the change. So when you see content, whether it's from any of these ladies or any of these organizations that are here, if you can, share it with your friends, share it with your family, comment, interact with it, because it helps it get to the people who need it.
Same. I think the biggest thing when it comes to Don't Clock Out is helping us take back the narrative around what it is to be a healthcare worker. We are not heroes. We are human beings who take care of other human beings. And when we are placed in impossible situations, we don't come up with superpowers. Like, we don't become inherently more capable of things than another individual because we have credentials under our name or training. We physically cannot do more than our bodies, our minds are capable of us doing. And so I want organizations, I want individuals to begin to see healthcare workers as human beings who deserve space, support to be able to take care of themselves before they take care of others. Because the system that we have now is creating a collapse across healthcare and is also creating a dire need for more of us. And sadly, people are seeing the writing on the wall and they don't want to go into these fields anymore. How do we make it sustainable? How do we protect healthcare workers? How do we support them? If we can understand that they are allowed to feel emotional when it comes to working in deeply human settings, that they are allowed to care for their own mental health and their own well-being, that they deserve the space to do so. And they also deserve to not be exploited to care for patients. I think just taking back that narrative. And also, in 2020, a lot of companies really love to put us on billboards and also say how much they supported their healthcare heroes and also gave us a lot of cool discounts. And suddenly those were revoked. And that's like super interesting and weird. But maybe instead of commodifying healthcare workers, we actually put our money where our mouth is and we begin to support them in ways that are long lasting and sustainable. And that's what we deserve. That's what our patients deserve. And I'm not trying to poke at y'all. I just, it stings, trauma does sting.
Well, I'm incredibly proud to, one, share a profession with all of you, to share this stage with you, and to really call you my friends, because I know that at any point through the power of networking, I could pick up the phone, call, text, or hit you up on Instagram. And we could take on anything in healthcare. So I can't thank you enough for coming all the way down here, for supporting us. Again, this is our first nurse panel at Healthcare Advocate Summit, so I'm so excited. But are there any audience questions? Do you want to ask anything of these ladies? And they will be around at the social later, so if you want pictures with them, I know I'll be taking them. Yes, Terry.
So, all of the stories are great, but it seems like the bigger question is the system. And really the system, let's face it, is our government. And it's all of the lobbyists and the blah, blah, blahs, right? So how do we collectively go there?
I have an answer. I mean, ultimately we need a total systems reform, right, in healthcare. I think we all know that. A lot of you are shaking your head. How do we get there is the real question.
Business suits not make the decisions, but us make the decision.
Us to make the decisions, exactly. So we have to take the power back. We have to take this industry back. And by doing that, I think there's a different type of method for every type of system that we have to do. So for example, name and shame, that works. Bad PR, bad press, that works. Impact in Healthcare is going to DC October 16th through 18th. We're going to be talking to legislators directly. We have a book that we compiled of healthcare worker stories advocating for workplace violence prevention, of folks who got hit in the face just because there was nobody else on their unit to stop the patient, barreling down the hall towards them. No panic buttons, no metal detectors. There's machetes in patient care areas. These are the things that we need to talk to them directly. Also, I mean, we're going down a rabbit hole here, but we really need to start questioning, why does the American Hospital Association have such a stronghold in our industry? These are folks that are generally not healthcare workers, and if they are, they're healthcare workers in title only. They should not be in our system, and we need to start calling that out and getting them out. calling out politicians that take money, which is over 60% of all politicians, and stop voting for them. That's it. We need to give them an ultimatum, essentially.
First of all, your stories are what it just makes me sad. I've been a nurse for 27 years, and so all of you remind me of my younger self. And I want to say thank you for sharing and standing up. I myself have been in private health advocacy for 8 years, probably very similar reasons, right? Echoing. And a part of me was wondering, why am I even coming to this conference? I'm sort of already, doing everything. And I have this feeling I know why I'm here right now. And that's to support the younger people out there. And that's sort of my question, is sort of being, I've been in administration. I've been on both sides, right? But how do we as nurses support one another in our endeavors that are out of the box kind of things, where we're not relying on any system? Instead, we're relying on one another to support one another in whatever you're choosing to do as a nurse. We still need bedside nurses. We need nurses in administration, right? But we need nurses who have their private organizations also. But how do I love the idea. I'm on social media. I can do all the likes and that. But is there a next level of coming together to support one another?
I think everyone here, we've kind of created this informal coalition of people who have just come out of the woodworks to create things that are new. And it just so happens that we kind of did it all around the same time and like the timelines aligned. But I think we're all united as well in understanding that nursing has been broken for a very long time. And that's from the top down, right? We have to acknowledge that our organizations have not had our best interests in mind. Our professional organizations have not had our best interests in mind. We have to have really difficult conversations about how we are represented and how us represented as nurses has caused damage to the profession for a very long time and has also decreased access to nursing programs, decreased access to marginalized communities to be able to actually become nurses. How not having enough associate's degree programs because of the push to magnet has increased gatekeeping into the profession and has backfired. How we have told LPNs you're not valuable in an ER setting, but when we have COVID, you can come back. You can come back. That is the conversations that we have every single day and that we try to amplify because we believe that changes the culture, builds community, and brings us back together and also encourages new nurses to come into the field because it's no longer like a club, a secret club that you have to get into. It's actually a community.
I think it'd be great to engage the older nurses.
100%.
We might have the funds you need.
Yeah, please. Some of don't clock outs like most supported
And some
individuals.
of us are not social media gurus because we're older. So
Yes.
how do you engage us?
Yes.
I think that coming to conferences like this, there are a lot of summits and things that nurses run, like Sarah and Abby and I, we just came back from something called the Nurse Boss Summit. It was in North Carolina, and there were tons of nurses who have really great businesses who want to get into businesses. And my background is long-term care, so I work with a lot of, veteran nurses. I won't say older nurses, but I work with a lot of veteran nurses, and they didn't understand what I was doing. But I think being open-minded and saying, I don't why are you writing? Like I had a nurse say, why are you writing? You're a nurse. Like, why are you doing that? And when I explained to her why I was doing it, she was like, oh, I always like to write. You think you can teach me how to do it too? And so I think that we just keep talking, we keep sharing, we keep being open-minded. We come to events like this and we network. And I'm not just saying I take your business card and I don't ever hear from you again, but I take your business card and I find you on LinkedIn, or I find you on, I'm still on Facebook. I'm an older millennial, so I'm still on Facebook. And I find you on, I find you on Facebook, and we talk about what we're doing. And I think that nursing has been, like Sarah said, like a secret society, and it's very exclusive. And, you know, if you don't have the alphabet soup behind your name, I don't care about what you have to say. And, you know, if you don't have all that, I don't want to hear what you have to say. But there are nurses who don't have that, who are making a huge difference. And we just have to be open to allowing them to make the difference that they can make.
And I think the common thread under all of this is time, right? We have to be able to give each other the time that's deserved. So, you know, I take full advantage of opportunities like this. I take full advantage of my scrolling before bed opportunities to talk to them. But I think that's the common thread is we're all busy. We're all short staffed. We're all overworked. That's kind of, we know that. So it's prioritizing that time and to reach out. And so when I get a message on LinkedIn, I read it. There are some that are spam, forget it. But for someone's like, I have an ask, you know, I need help with this. I have a patient I'm struggling with. That direct ask, I will give time for that. And that's, you know, that's my way of giving back. And I think in the development of social media and growing, I think in our veteran nurse population, that's a great way to put it. There's an ability to give them time that they may have had when they were a nurse that we don't have now. So there's like a bridging of that piece. And I think that's where we make a difference. And again, we start having more nurse panels, Melissa. Yes.